Hi, welcome to BioBalance Healthcast. This is Dr. Kathy Maupin.
And I'm Brett Newcomb. And we have a guest with us today, Ms. Abby Calabio, who is a nurse practitioner and medical esthetician. You'll teach me how to say that right, at BioBalance Health. And we're going to be talking about a whole different section of treatment that's available at BioBalance Health. And Abby's going to talk to us about it. If you would, first start by telling us what a medical esthetician is and a nurse practitioner.
I'm actually a board-certified nurse practitioner, and actually there's only really one of three of us in the St. Louis area that does specialize in medical aesthetics. I do have about 5 years experience in the field of medical aesthetics, and basically what I do is I provide services such as cosmetic injections, and I'm also a laser specialist.
So tell me a little more, if you would, about medical aesthetics. I hear that term and it sounds really significant, but I don't know what it does. Are you an artist?
I am.
So a medical artist,
medical
so to speak?
aesthetics really combines science, at the same time combines artistry. So when I really approach a client, I think about all the science behind what I can do, but at the same time, it's about really analyzing their face, looking at their features, and really thinking about what is it can I do to improve their look, really help sculpt their face.
And when you talk about improving their look and sculpting their face, you just mentioned injections. Before we started, you mentioned to me that it was important to know that the injections that you use are what are called purified proteins. Can you talk a little bit about that?
One of the purified protein injections that I offer is Botox. And what that is, it's really considered the #1 selling non-invasive cosmetic procedure out there. What it does is it works, when we inject that, it works by really, it blocks that signal that causes our muscles to contract. So when it does that, it smooths out the wrinkle. At the same time, what's great about it, it causes a lifting effect. So when it's injected between your brows or around your eyes, you really get a more, refreshed look. You're more wide awake, and it really is helpful for people just to really give that lift, kind of brighten the eyes.
So Botox is primarily an upper face treatment protocol?
Exactly. The ideal areas to inject that would be between the brows, where people get, what they call those 11s. And also, it's helpful for treating the creases to the forehead, and even the areas around the eyes, which we call crow's feet. You can even inject minute amounts of it around the lips for people who have those vertical lip lines. And even by injecting just a little bit on the top lip can even kind of lift up and kind of plump up that lip as well.
So mainly from the nose up and just a little bit around the lip line?
Yes.
And that's Botox.
So a good rule of thumb is Botox can be used for the upper face, and then we're going to be talking about fillers too, and that's really primarily used for the lower face. And
so if I were to come and see you and say, what can you do to help? Right. What would be the first thing that you would do with me?
Well, the process begins by coming in and having a consultation with me. Really the first thing I ask clients when I meet with them is, what brings you in? When you look in that mirror in the morning, what is it that bothers you? What bugs you? And, for example, one thing a client would be like, when I look in that mirror, I just cannot stand, the wrinkles around my eyes. So there's definitely a lot of treatments out there, that can help. One being Botox, and we also have, some great products as well that that help build collagen, that can help smooth out those wrinkles too, in addition to the Botox.
Okay, so I have a friend who had a major illness. She is now better, but she lost so much weight, and she got really gaunt and hollowed in her face. That hasn't come back. Her health has improved, but her face just looks a lot more aged and a lot more gaunt. Could you help someone like that?
Oh, definitely. I do see a lot of patients who, through dieting, have also lost a considerable amount of weight. Even losing 10 to 20 pounds really can make a difference in all the volume loss that that you can have in your lower face. So one thing that we can do is provide dermal fillers, or they're also called facial fillers. There's definitely a lot of facial fillers out in the market, but the two that we offer at BioBalance are Radiesse and Juvederm. Juvederm, what that does is it's a volumizing filler. It's a calcium-based filler that really can help with enhancing the volume, bring that fullness back to your cheeks. So when you inject the cheeks, it also has an effect to lift.
Kind of like a jelly-filled donut.
Yeah,
Just
so
puff
it
that
lifts, so not only is it improving that volume, it softens these lines at the same time, helps with that sagging and that jowling that, that a lot of women complain about.
Mm-hmm.
So in essence, it's kind of like having like a liquid facelift.
Which is a non-invasive procedure.
Yes.
Doesn't require surgery.
Exactly.
And lasts roughly how long?
Depending on the filler that you use, Radiesse is nice because it does have longevity.
Mm-hmm.
So you're looking at, sometimes for women, up to a year. There's another filler that we carry, and it's called Juvederm. It's a hyaluronic gel, and that's ideal for really injecting these areas, like what they call like the parentheses, and also really
To fill them in or to heighten
to really
the
soften
line?
and to fill those lines so they don't look as distinct.
Okay.
And also we can use that Juvederm to really fill in that vermilion border or the borders of your lips and give it, more, fullness.
The whole point of this is to look younger.
Yeah.
And if you look at pictures of yourself when you were 20 or 30, you didn't have parentheses, you didn't have wrinkles, your eyes were higher, your eyebrows were higher, your eyelids were more obvious, and you had a vermilion border around your lips so that it kind of turned up. And those are the things that make people look younger. You didn't have any jowls, and you had really full cheeks. That's usually the look of somebody who's very young, and that's what we're trying to bring us back to. We're not trying to bring us back to look like someone else, but to look like ourselves 10 to 15 to 20 years before.
But you don't get Tammy Faye Baker eyes. You don't have that look of permanent
No,
surprise.
and that's why you go to Abby.
Yeah.
Yeah.
And
Abby has been doing this so long that she has the artist look of your face, and she can really make you look like you did before.
So what I really recommend for clients when they first meet with me is to really bring a picture of yourself, when you're younger.
Mm-hmm.
From there, I could really see what kind of features you had. So I know when I recommend things, we're not going to do something that is going to make you different. My approach really to treating patients is conservative. I want that client to, look natural. I want them, to look more youthful.
So not have a plastic face.
No, I mean, my goal is to help them defy aging and gravity. I want them to look good and just really feel confident about themselves.
Mm-hmm. So in fulfilling this goal, a couple things that you've mentioned. You're one of 3 in the St. Louis metropolitan area that are
That
credentialed
specialize.
the way that you're credentialed.
Correct.
You develop a treatment plan which identifies all the concerns and lays out possibilities for that, but you ask the patient, what bothers you the most, where do you want to start, and you just do what they want. You're not selling them anything. You're saying these things are available, we could tweak this, see how that makes you feel, with the goal being to make you look and feel younger, feel your best. And then if you want another step, you can come in and get another step. Tell me about this this new computer thing that you use.
It'll show the level of wrinkles that you have, the level of UV damage. Just even if you have issues with redness, it'll give a readout of the percentage.
So are there predictive values in that? Can you look at me and say, oh my God, you're going to look like a prune in 6 months? Or is it just a current snapshot?
It's a current snapshot, and basically what it does is it's analyzing the client, comparing it to women of their same age and skin type.
Okay. So it has this huge database, and it looks at all those things.
Yes.
And then you get a printout?
You do. You get that profile, and you can actually take that printout home.
Mm-hmm.
And based on your readout, your profile, that's where we can really talk about and recommend, and I can advise them on what would be a great skincare regimen for them, or what services could really be helpful to really help them look younger or help restore.
So I look at that picture and I look at that printout, and I talk to you and I say, look, looking at all this, I have that huge 11 o'clock thing because I think so much and it's hard, or because I've been depressed most of my life, and that's hard too. So that's an upper face issue.
Yeah,
and then I have these huge bags under my eyes. That's a lower face issue.
Yes, definitely.
And my lips are really prim and prissy, and I don't like that. Can you help me with those things?
Definitely. First,
Who would I look like? Would I look like me?
yes, we'd look like you.
Okay.
I mean, there's
I
stuff.
wouldn't look like Ted Kennedy or somebody.
No,
when you
I
finish.
mean, I can make you look like that, but we're not going to do that.
Chipmunk?
Yeah, we're not going to do that. Like I said, my approach is really a conservative approach. I want people to look natural. I want them to help, defy aging and gravity.
So it's kind of like Grecian formula for the skin.
Exactly.
You just tone it back gradually so that people start to say, "You're really looking good. What's been happening?"
But most patients don't know what they want. They
Right.
hear the word Juvederm, they hear the word Radius, and I mean, I heard it. I thought they both did the same thing until we were really educated about it, and I then understood that from Abby that Radius is for lifting and lasts longer, and it's mostly for cheeks and chin, and that the Juvederm is mostly for the 11 o'clock or the parentheses and the lips because it's a little bit thinner, so it doesn't last quite as long, and that's kind of what you want. But I didn't know what all those products do. They just hear the names, patients hear the names like I did, or they hear the names of lasers, they don't know what they do, and they just say, I'm coming in to fix something on my face, I'm not sure what do you think would help me? They want some guidance. I wanted some guidance when I met Abby and said, what do I do to get rid of this or that? And she did it.
And all of these injectables are purified proteins. And they're not animal products where you would have to have allergy testing to know if it would be okay for you to use them.
No, they are perfectly safe. Botox is the purified protein. As far as the fillers go, they are synthetic products that really mimic the natural components in our skin.
And so there's no skin rejection or body rejection
No.
issue of a synthetic product. And it eventually will metabolize. You're looking at 3 to 6 months, depending on which one you're talking about.
For Botox, the longevity of Botox is about 3 to 4 months. So to really keep up the results, you want to get injected about 3 times a year. With fillers, they have the advantage of lasting a little bit longer. For Radius, you can get up to a year. And with the Juvederms, about 6 to 9 months.
Okay. So this is really fascinating to me, and I hope that it's interesting to you. If it is interesting to you and you have questions about it, you can contact Abby directly at BioBalance Health. You can contact Kathy. You can look at my blog, which is brettnewcomb.com, and reach me through that. Kathy, how would they get you?
They would go to our website at biobalancehealth.com, or they can call my office at 314-993-0963.